Hi, I'm Whitney, and I decided to do my research on dementia. I am a little bit familiar with dementia, but I decided to do this because I actually work with dementia patients in a nursing home, and it's just something that I'm really interested in, is dear to my heart. I love caring for these individuals and making sure that they're comfortable, happy, and healthy. First off, dementia is a memory or a brain issue. So your healthy neurons are turning into unhealthy neurons and eventually causing damage to the brain. And so depending on what part of the brain is damaged depends on how severe or what kind of symptoms that you have. With that being said, symptoms can be confusion, wandering, memory loss, losing things. Those are your main symptoms that you think of when you hear dementia. And they're very common. You see it in all dementia patients. Another one that not many people may know is repetitive behavior. So with the memory loss, people may have issues thinking that they didn't ask something and they did, or they didn't, or they thought they asked it but they didn't, and they just can be repetitive, or they can do the same thing over and over again thinking that they didn't do it. Like, they may think that they brushed their teeth or didn't brush their teeth, and they did brush their teeth, and they may sit there and do it over and over again. So that can get very frustrating for them, because sometimes they do recognize that they are doing repetitive things, and it causes them to get frustrated. And sometimes they just have absolutely no clue. Another thing is speech problems. So their brain isn't thinking as fast as it used to, and they have trouble getting their words out in the order that they want them to be in, or they may just say the most off-the-wall things thinking they're saying something, and they're really saying something different. And that gets really frustrating for them, especially when, like, for example, if I'm caring for one of my residents, they are trying to explain to me that they want some water, but they say, I have a shoelace. And it's like, what? That don't make no sense. And then they get frustrated because you're like, you have a shoelace? And really, they're wanting to say, I want water, I'm thirsty, and you just have no clue what they want. And so both parties could get frustrated really easily, so you just have to be patient when things like that happen. And that happened. It happened the other day. I was like, you want a shoelace? What? And really, they just wanted water, and they thought they were saying they wanted water, but they were actually saying they had a shoelace. So, and also with dementia, you see trouble with everyday tasks, like the main one is putting your clothes on, or changing, like taking them off and changing into PJs. They kind of forget the process of doing that, or what comes first. Like, does your underwear come before your pants, or your shirt come before your bra and undergarments and whatnot? So a lot of frustration with dementia patients. So there's not really any main cause that we know of. It's still being researched. It's been researched for quite a while, and there's just no set in stone cause for this. It is very common as you age. It's actually super, super common that most of the time that people will get dementia. Not always, but a lot of times elderly get dementia. And you may not even know for years and years that you have dementia. You may just see little signs of it, and it never get caught. It just is all different for everybody. The first step to diagnosing dementia is you'll want to see your primary care doctor first. So a lot of the times, since this is something with the aging individual, a lot of the times a family member notices that they're just forgetting things a lot. They've got lost. They've called at the grocery store saying, I can't remember how to get home, or I don't know where my keys are. Family members are the ones that usually notice it first. So when that happens, you can take them to their family care doctor, and they'll probably first run some vital signs, blood work, and see if there's any underlying issues that may be causing this. For example, UTI shows symptoms of confusion and memory loss, and it's bizarre because I see it every week, honestly, and you think that they have dementia, but really they just have a UTI. So they like to do testing or like vital signs and blood work first before just jumping to the conclusion that they have dementia. After that, if your primary care doctor doesn't see any underlying issues and they think that you may have some form of dementia or some neurological issue going on, they will refer you to a neurologist. And at that point, the neurologist will order some scans. Some of the common ones is like a brain scan or an MRI. And then a psych eval and a cognitive and neurological eval. So they will run them through so many tests they'll just sit down, ask questions, and see what all they know, and just kind of get a good idea if they have dementia. Another test that is usually not covered by insurance is a cerebrospinal test. And that's usually not covered by insurance. And honestly, at that point, if it gets to that point where they're wanting to do that, they probably have it. It's one of those last resort kind of tests that you do. And a lot of times it's like family members or the actual individual who are just really denying that they have this and they want more testing, and so they'll go forward with that. Treatment, there is no cure. Unfortunately, they are still looking for a cure, but there is a medication, and I'm probably going to pronounce this wrong, so bear with me, Leqembi, that has been somewhat, it doesn't cure dementia, but it helps slow the process down. They're in phase 3 trial, and it slows cognitive decline for Alzheimer's. So it was approved by the USDA, FDA, and so that's great, but it's not a cure. And some other forms, it's not treatments to cure it or anything, but this can help. Some medications for some symptoms, like a lot of the times with dementia, they get so frustrated and confused, they get depressed, and so they can get depression medications and stuff like that. And then therapy. And therapy is not something that will cure them, but it can help them with everyday tasks and keeping their momentum and their endurance to do those things. The prognosis, there's no definite prognosis. It just kind of happens with time. As you age, it gets worse, and everybody's different, like I said before. So there's no definite prognosis. There's no time frame. Everyone's different, so you'll see different speeds of dementia. And then lastly, diet. There's no diet that you can do. No diet, no cure. It's really unfortunate. But you can help with everyday tasks. So like if you're caring for an individual at home, trying to help them and teach them, continue to instruct them and redirect them on how to do things can help like speed up the process, or not speed up the process, but help them to hopefully remember and remind them from day to day what kind of tasks they need to be doing. Keeping them active is like 100% good for them. If they're just sitting around not doing anything, they're going to lose their muscles and have atrophy, and it can really cause a toll on them. So keeping them active and helping and encouraging them to do a little bit of exercise, like go for a walk, or even just kind of doing this, sitting on the couch, just picking up milk jugs or whatever they can tolerate handling will help them. And then just really honestly, the best, and not all people can do this, but family help is very, very helpful with them. It continues to remind them that they have support and their loved ones are there, and it actually helps for their memory loss. If they're seeing their individuals every day, it helps. Whereas if they didn't see them every day or seeing them every few months, they may be more likely to not really forget you, but forget your name or forget memories. So dementia is very sad. It's very frustrating for both the person who has dementia and the one caring for them. It's a hard process for each family and each individual with dementia. So you just have to be patient and kind and loving, and realize that even though they may not remember you, or they forget that they ask the same question a million times, they truly don't know. And sometimes they do know, and it does frustrate them because they ask what time it is multiple times in like within 10 minutes of each other. And like they know that they've asked it, but they can't remember. And so it's very frustrating. And so you just have to remember to be patient and be kind and just love on your loved ones and be there for them and support them. So thanks for listening. I hope you enjoyed, and I hope you learned something.